Hello, everyone. If you don't know already what you signed on for, I'm Dr. Sandra Dreisbach. I have a background, MA, PhD in ethics, ethical decision making, and moral psychology. I taught at university for more than a decade. Also have a background in a few different energy lineages. And I've been dedicating myself now to psychedelic ethics practice, and primarily in community, but also one-on-one and doing individual support and doing training around that. But today we just have an open conversation around ethical practice and responsibility and what that means. And I'm not going to go over any sort of community agreements for today. But just in general, I just ask that people treat each other with respect, that we acknowledge that this is not a strictly confidential container, and to recognize that this is an adult space means that you are responsible for your own needs and for your own resourcing of your own needs. And ethics conversations can often be triggering and can bring up issues. So if you feel like something comes up for you or some sort of concern, make sure you have the resources available to you, because this is not a container that can support you. It's not a therapeutic support container. So you're going to have to take care of yourself in integrity for you. That said, if you do need to leave early, I do appreciate knowing that you're okay. You can send me a DM message to let me know that before you leave, or you can just set, if you feel comfortable saying it to everyone. And also the same thing for questions. If you have questions that you don't feel comfortable voicing to the larger group, but you still want it to be raised, feel free to DM me that message. You should have that permission to be able to do that in the chat. And you can let me know if that's not the case. But my hope is that we'll be able to just share in conversation. I see, Isabel, you have your hand up. I also open up if there's something you feel like we do need to make sure we voice and make it a sort of agreement right now. I want to open up the space for anyone to bring that up. Especially since this is my first time hosting a Q&A with Nectara community. And so that, in terms of people who are more familiar with that community, I want to open up things that are already expectations for you in that space. Isabel. I can't hear you. You're on mute.
I am so sorry. I used the link on an invitation from Pascal, which was I'm in the wrong meeting.
You're in the wrong meeting.
I am so sorry, Sandra.
You were in the right meeting to say hi to me, though.
Yes, I did. And to see that Ella's here, so I'm so excited. But
don't go.
I'm sorry, I have to go.
No. Well, I'm glad we got to see you, though, Isabel. And it's probably just a cue for us to reconnect.
Yeah.
Mercury style.
Yeah, I'll talk to you soon.
Thanks for saying hi.
Okay, bye.
And at least we covered enough bases so that she knew she was in the incorrect room. But anyway, so since I've had a chance to introduce myself and we have a nice small little group here, which is my favorite, I want to give us all a chance to briefly introduce ourselves and just take 1 to 2 minutes max to just go around, because we only have about an hour for this conversation. So I want to spend most of our time in conversation. If you could each introduce yourself, and if you could say one question, because you were asked to bring a question. It's okay if you didn't come up with one. You can come up with it on the fly, or you can just say, I'm more curious and open and receptive to what other people are going to bring up. All things are okay. Okay, I'm going to just, we can do it popcorn style, but I'm going to go ahead and read it, and I'll make a speaker order based on how it's presenting to me. So it's going to be, let's see, I don't know if it's going to, wait, I'll do it this way. Ella, I'll do commas. Ella, Donna, Brad, Nikita, and we have Daniel and Danny. Hopefully. So we'll do in that order, and then myself, I'm last and first. Okay, with that said, so Ella, if you feel comfortable introducing yourself and coming onto screen.
Yeah, hi, thank you, Sandra. Let's see. So just say something about myself and then a question I have. Yeah, okay, so I'm Ella. I'm based in Santa Cruz, California. I am primarily a preparation and integration coach with a focus on IFS. I have a lot of years of training. It's been part of my own path of healing, combining plant medicines, parts work since 2017, and I now serve others in that same way, and also combine deep feminine wisdom embodiment practices along with parts work. So I would say, I haven't quite formulated this. It's something I'm noticing around ethics. This may be a bigger conversation. Let me just think how to say this. It's really a question around attunement and around, since my orientation is really around parts work and IFS, noticing that I'm supporting some people who are, I'm going to actually refine what I was going to say. I am supporting clients who are having experiences in the underground, are having some rough experiences with guides, and then with pre-verbal trauma, and then are left without anywhere to turn or any kind of accountability or any kind of ethical understanding of kind of what their options are around support, or understanding kind of what the agreement is between themselves and a guide. And so I guess my question is, I'd really like to hear sort of whether it's possible to, as a guide community, to adopt really high standards that we all understand, and what accountability might look like, so we can support ourselves as guides, to really ensure safety. My concern is really about harms that I'm hearing about in the underground, and how to both support and think about what a more kind of guide community ethical set of practices and support might look like. So I'm sorry that was so long.
No, it's fine. You voice a lot, and I think it's really important. I think I've only really captured the first part of
Mhm.
your question, and you can feel free to correct me, but is it possible to develop really high standards and create accountability to really ensure safety?
Mhm.
But then you have the second part too, but we can try and voice. But let's see if it comes up again.
Yeah, others might have others too. And if we have time, I have a more nuanced and specific set of questions about
Okay.
specific modalities I'd love to run by
Okay.
you.
Okay, great. I love it. Yeah, I really appreciate that, Ella. Okay, Donna.
Let's see. I'm a just retired psychiatrist and a pioneering psychedelic researcher for the past 35 years. And I've been a therapist that whole time, and very interested in how to help train people to be able to do their own attachment disturbance work so that it doesn't get reenacted in the field. So I'll keep it shorter rather than longer. Thank you. Thanks for having this webinar. It's very useful.
Yeah,
Thanks.
for sharing that and welcome. Yeah, so I wrote down how to help train people to be able to do their own attachment disturbance work so it doesn't get reenacted in the field.
Yeah, and I guess I have one of the questions that has been difficult to deal with in my actual work with people is, how do you get consent from every single part when the person often doesn't know what every single part is?
That's super rich for me. I really want to talk about that one because yeah.
And you're referring to IFS work in particular, right?
I'm not. I'm talking
Okay.
about, it doesn't have to be IFS parts. I'm just talking about whatever model you want to use of parts, which has been all kinds of parts. Yeah. Thank you.
Okay. Great. Thank you. Yeah. Okay. Now we have Brad.
Hello, Sandra. Hi, everyone.
Hi.
My name is Brad Gretzinger. I'm calling in from Vancouver, BC, Canada. My first conference was the Psychedelic Psychotherapy Forum in Victoria, BC, Canada here. And that was 2015. Since then, I've been extremely interested as a Bachelor of Commerce graduate in finance and marketing. And I left finance because the lack of ethics in the financial framework. And I went to marketing, and there was one class on ethics. And I remember, we talked about the typical snake oil and some of these infomercials and the way that people in business would steal money, but I was just so undersatisfied. And I had a conversation with a chief elder up in Squamish, And in an hour and 40 minutes, I got more about ethics and understanding about business and economics and ecology. And so my interest in this is really to combine these amazing therapists and these people that really know how to do the work and resonate with people and attune with the people who understand economics and business with a Bachelor of Commerce background. And so to my day-to-days, I'm coaching people with identity formation and integration. And so I've had a real interest around this integration word ever since 2015, meeting this community of psychedelics. And so I'm totally here for it. I'm like one of Sandra's #1 fans. We met on Clubhouse. And so and when I saw the email, I just clicked sign up. So I don't have a direct question, but maybe it's like how to link that gap in some of those places and how to be the in-betweener and how to be somebody that really can be with lots of different groups and ethically how to hold that space in our own self when we hang out with one group and they're saying, well, you're ethically wrong, and you hang out with the other group and they're saying you're right, and vice versa. So I'll pause there. Thanks for having me.
So just to clarify, Brad, I'm writing down.
Yeah, let me summarize it. So
So I put in, this is what I put in. I put in how to bridge the gap between communities, both within psychedelic communities and in larger world and society.
cool. Yeah, I like that.
Okay, great. Thank you, Brad.
Yeah.
Okay, Nikita.
Hi, I'm also from BC. I'm from Victoria, actually. So Brad will have to connect. But right now I'm in San Diego. I'm heading down to Peru in January to do my first dieta. But I have been working in this space after many pivots in healthcare because of ethical reasons. And I think I'm finding the same challenges now in the psychedelic field. And so my question really is around I'm thinking about the ethical lapse that sometimes happens when time pressure and money incentive is applied. And I'm worried that's happening now in the psychedelic industry. And I'm wondering if bringing the business and time pressure and money and growth and expansion into this is actually doing the opposite that we want it to, or is it bringing us closer to unity and the goals that we want to create with the planet? So I have a lot of ethical questions, but I'm going to leave it at that.
Okay, so what I wrote, challenges around time pressure and money. Does time pressure and money actually work in opposition to ethical practice? That sound relatively fair? Okay, great. These are all amazing questions. I'm loving all of this. Okay, Daniel, you ready?
Yes. Hi. I don't know. Can you hear me well?
Yes.
Okay,
Good
great.
connection. Congratulations in Peru.
Thank you for, yeah, I'm in the Sacred Valley here in Cusco, so signal is kind of floppy sometimes. And yeah, this field has many questions since it's all new regarding ethics. All of you guys already put some good ones, and I think an hour could be really short. So the first one that comes into mind is how we sell the psychedelic experience or the psychedelic treatment. I feel that there's a lot of hype because of the results around the studies, and there's always a percentage of people who don't see the benefits. And sometimes I feel, maybe in group settings, especially in ceremonial settings, that they are not informed of the possibility that these sessions might not see the trauma that they want to see or heal the way that they want to heal. I could also do another one, but I think I'll just keep it on that one.
And tell us a little bit about you, Daniel. I want to get to know about you.
Okay.
It's really important for us to build relationships.
Forgot about that.
Now.
Forgot about that one. Similar to Brad, I come from a corporate background, studied business. I'm working 14 years in Lima, capital of Peru, where all the main business goes on. And through plant medicine, specifically ayahuasca, which is legal down here, gradually my values shifted, and I could see that I can no longer fit in this corporate environment. So started lasting less time in some jobs, just quitting because of values, and decided to finally take a sabbatical. And in that sabbatical, I popped up into San Mind Institute program for psychotherapy assisted with psychedelics. And I'm in the middle of that program right now, studying all the way from Peru. Yeah, that's me.
Awesome. Thank you, Daniel. Yeah, and actually that was one of the practitioner programs I went through. So I'm
Great.
familiar. Hey, Danny, are you there? And Daniel, before Danny chime in, I wrote it, how do we sell the psychedelic experience / treatment, especially given the hype and misunderstanding about the benefits in ceremonial settings in particular?
Yeah, that's great.
Danny.
Hi, so my name is Danny. I'm a doctor up in Ontario, Canada. Right now I'm working in the way remote north on a First Nations community in the middle of nowhere. My background is science and biochem is I'm a PhD candidate in biochem as well, but during grad school I found a love for philosophy and ethics and all branches of philosophy and exploring that, and that was really wonderful. Right now aside from my work in the remote medicine, I also do full scope psychedelic assisted therapy, mostly with mushrooms in the harm reduction context. But I did recently do my first ketamine infusion in the remote northern community. So it in a nutshell. So I do have a huge interest in creating standards in this work because I've seen the enthusiasm that, the well-intentioned enthusiasm that is happening with therapists and people who have one session and then all of a sudden they're like, I want to do this to save the world, or sorry, that's a bit facetious, but I want to do this to help people, but maybe get in a bit over their heads or get into the area without really having a sense of what the work is or what the substances can do and where there's potential for harm. So I'm really interested in creating standards for them, for the work. But at the same time, there's this question of how do you create a common standard when there are so many different ways to get to the same place. I have my own, I see psychedelic assisted therapy as it truly is its own modality of psychotherapy that requires certain things for preparation, dosing session, and integration. But other people really take more of an intuitive approach using more somatic approaches. And they also have fantastic results. Similarly, people doing group therapy using more co-creating of a space and co-regulation of nervous systems, and less work specific preparation of creating intentions, but just naturally through being able to do this work, being able to enter a psychedelic space with a regulated nervous system and how that can facilitate benefit. So anyway, that's all to say that there's so many ways to get to the same place. So what does a common standard look like? What does a common standard look like? And with the understanding that it should very clearly be rooted in ethics and practical ethics. Anyway, that's it in a nutshell.
Okay, great. Thank you,
Yeah.
Danny.
Mm.
I phrase it as this: how do you create a common standard when there are so many different ways, modalities for psychedelic practice? What would a common standard look like?
Yep.
And I realized I didn't position myself in terms of where I'm located. Actually, I'm in the same area as Ella. I'm in on unceded Amamutsan lands in the Boulder Creek area of California, in the Santa Cruz Mountains. So about probably just 30 minutes away from you, Ella. It's a little rainy here. It's lovely. Okay, now that we've had our first half, we'll introduce each other and got to know some of our questions. I want to give you all a chance to upvote. You'll see that there's a reaction feature to the questions on the side. You can see the little smiley face and you can tap on it. I'm sure we like all of the questions. It's not a question of judgment. It's just a way to prioritize which questions for this particular group of people seems to be coming up more foregrounded than the other. But I think it's just nice, even just to presence even these questions, because I think all of them are really valid. And you'll notice some similarities between a lot of the questions you guys are asking, for instance, about how do we actually do ethical practice? How can we actually be responsible given diversity in the space? How do we have respect, integrity, given that there's time pressures and literally a capitalistic corporate structure, and that's very colonialized? What the limitations, self-awareness of people who we'd be working with, and the challenges that come up with that. And then even the larger community question, even if you do have resolved all those issues, you still need to find a way to effectively communicate that and bridge the gap. across the space. So are there particular ones that feel free to all of them, but like if you love a particular one, I see one heart here. I see, and obviously you can love your own question. So let's give ourselves a minute to look at that and reread the questions and reflect. And it looks like there's 2 for the last. And I'll generally, we'll see what we can touch on, and we'll try and, now that we've heard all the questions, we can try and think about these other questions, even if we're focusing on certain ones.
Sandra, I would say mine is basically the same as Danny's. It's really about
Okay,
the standards. I'm fine to kind of leave mine.
okay. Consider the last question to stand in for that first question.
Yeah.
Any other thoughts or reflections? Challenges around time pressure? Okay. We can continue putting, but I think we'll start with the last one, which is kind of nice because we just ended there. And look at this question of how do you create a common standard when there are so many different modalities for psychedelic practice, and what would a common standard look like? I'm curious to hear what a lot of your responses are, but I also want to invite you all to do a little reflection for yourself right now in terms of how you would answer this question if someone came to you. But if a client came to you right now and asked you, do you have a standard for your practice? And what are the modalities you work with? And how do you reconcile that to have a responsible practice? What would be your answer? Not to say anything yet, I just want you to contemplate and think for yourself, like how would you yourself, without having talked to anyone else, ground yourself in that question? Okay, so one response could be that there isn't a common standard, and we may not develop a common standard, but that you could probably share what your particular practice is. Well, this is the standard of my personal practice. This is the code I go by. This is how I work out my modalities, and being clear and transparent for yourself in relationship with your particular clients or journeyers that you're working with, and clearly communicating that effectively, even if there isn't a larger standard of practice. So I just want to say, in terms of the overall question we asked for this Q&A session about how can we be responsible in our practice, given that a lot of these questions aren't resolved yet as a larger community or international community, I would like to gently suggest that you can actually answer this to some extent for yourself and be transparent in your practice and be responsible in your practice, even without these standards being established, and be able to figure out what for you is that answer and be able to communicate that. So that's my feedback, but let's open up and hear a couple of thoughts and reflections on the question as originally posed, or anything that came up for you when you were reflecting on it. So feel free to either just come off of mic and do popcorn style for a small group, or you can raise your hand using a physical hand or using the little emoji hand at the bottom to the right of the reactions little smiley. Yes, Donna.
I'm in a 3-year psychedelic psychotherapy training program right now that's through a South American group called AWE. And the very first course that we took is Kylia Taylor's Ethics and Care course, and it's actually online. It's the best ethics course I have ever taken. And she gave us some tools that were marvelous to use, and ways of thinking about things, and ways of creating small peer supervision consultation groups so that we actually can look out for each other. I just think her course is fantastic if anybody's interested in it. Kylia Taylor.
Yeah, Kylia Taylor wrote the book Ethics of Caring, so you can pick up that's one book.
Her course even goes way beyond that in terms of the tools that she offers in the course.
Yeah, I don't know whether or not that piece is, but I know there's like Psychedelic Support has 3 little offerings, but I don't think it goes into the details that you're talking about that I know she developed for the AW program. But I think Kylia has a lot of great information as a practice therapist, and her background is having worked with MAPS, with MDMA assisted therapy, primarily in Santa Cruz, and now working in a lot of the teaching and training, and a lot of people make reference to the book too. yeah, so definitely worth, do you have a personal answer to the question?
And I think that the standard is really to ask the question over and over again, who is this for?
Mm,
Whatever you're doing, however you're being, whatever way you're being, it's always asking, who is this for?
yeah, I think there's so many great questions that we can ask, and I think doing that reflection work.
Yeah.
I know she talks a lot about inner ethics, and which is from a lot of philosophical practice about knowing yourself.
Mhm.
And she has often shows up the different chakras and how that they deal with different power abuses of power and money, sex, power, and goes through all the different ones that way as a way to self-check. Asking the question, who is this for? Another question, at least in ethics, is like, for whose benefit? This comes from ethical practice and traditions.
Yeah.
And it's a way to do a gentle inquiry to ask what is the basis of. So if you're creating a standard of practice, if you ask the question, who's it for? Who is the standards for? And my answer to that would be that it would be for you and for the practitioner.
Yeah.
And that the people who stand to benefit, and also the community, and also traditional medicine keepers, depending what your relationship is and what medicines you're working with.
Great. Thank you.
Yeah. Other thoughts, reflections on this question?
Yeah, I really appreciate what Donna said, and appreciate you bringing Kylie Taylor's work into this. I've done some consultations with her, and I really appreciate what she's doing with inner ethics. And I know for me, one of the things that's really been central and that I lead with clients is just the ethic of rupture and repair. That's really central, and all parts are welcome. Invitation, including the quietest whisper in the system. And also for myself, it's my ethics really come from my own years of IFS practice and really knowing my own system and being able to discern when I'm speaking from a part of myself, which means I have an agenda. So that always means you're in a part rather than in self. So I have a lot of like U-turn practices to come back to whatever part has an agenda or wants to help even. And so I also invite practicing naming boundaries in the preparation. And so they're really authenticity is really welcome.
Yeah, thank you for that. Yeah. So far what I'm hearing is more of a reflection of certain things that are useful in a standard. And maybe I'll go ahead and go to Daniel in just a second, but I just want to make sure I'm reflecting back what I'm hearing. Right. So the first part about what Donna was sharing about doing self-reflection, having a community of practice, like a peer support or peer, and I think that more and more that peer mentorship, I'll put that in there, as well as what you were saying about supporting rupture and repair processes would be important, as well as, of course, consent. All these, you would want this to be encouraged in a standard. I'm just going to put that in there. Right, so encouraging self-reflection, encouraging peer mentorship and peer groups, encouraging rupture and repair practices, as well as working around consent as part of things that would be important in a standard. It doesn't mean that even if you had different modalities, we could still encourage people self-reflective to be in a peer mentorship group, to have rupture and repair and to work on consent, even if there are different things that might be appropriate for, like you may have different consent things you need to go through. If I know there's a practitioner in the Bay Area who works with ketamine and massage. So there are different things that would come up with ketamine and massage than what would come up with someone holding space for, let's say, a regular intravenous ketamine treatment, or someone who's in a ceremonial setting and respecting the practices of that particular ceremony or culture that may be different than what their culture may be coming into. So there might be extra things around consent and boundaries and respect that wouldn't be necessary in going to a clinic, but would be necessary in a different culture, a different community setting. Okay, Daniel.
Okay, this is a good question. And I think standard-wise, the ethics part is where we should focus. Consent, peer report, and peer boundaries stated before the sessions. that is something that we should focus on. It's key thing in this field. It's kind of gray, and I've heard a lot of testimonies about abuse in clinical and ceremonial, and that's kind of why I'm here in this group. Regarding like the standard of how the practice should be, that's where I think it's very open, and I've seen so many different practices that have helped people in different ways. The substances just also change from substance to substance, from setting, like you were saying, massage or touch. Those are the trickier ones, but they also some appear to help. Yeah, that one, I think, because we come from this Western approach that things should follow a procedure, and these are the steps, and this is the recipe of what you have to do. We kind of want to put psychedelic field in that way, but these substances, many of them come from way before our Western approach of medicine, and from all parts of the world, not just South America, just Africa, Asia, Northern or Europe. There's many approaches. So that part of what therapy, how to combine it, I think it's very personal. It's very to what helps each person. But I think if we were to focus on a standard, I think a good place to start is on the ethic part. That's why this talk is very important.
Yeah, thank you, Daniel. I really appreciate that. Yeah, I think it's that sort of yes and answer. There may be an element, like you were mentioning, about different medicines that will have maybe different types of practice and standards of care that you might need. I also added like different intentions, like if you're doing it for therapeutic or healing PTSD or substance recovery, there might be different methods that may be important or necessary. Or if you're a therapist versus if you're someone who is a spiritual practitioner, that different intentions related to that. But still, you can still have the sort of key ethical principles that treating, one of the things I like talking about, at least in terms of traditional bioethics, has 4 central principles. One is non-maleficence, which is to do no harm, from the Hippocratic Oath. This is again Western. Beneficence, which is to do good, to be of benefit. The other is respect for autonomy of the person's ability to make their own choices, right? That's where informed consent comes in. And then justice, that's where issues around equity and distribution of benefit also comes up. And you can approach those from a whole bunch of different theoretical backgrounds or apply them in different ways. And what does it mean to respect, to do no harm when you're in a setting that's medical versus in a ceremonial setting. But you can still say, like, if you're going to the doctor, at the very least, you don't want to be worse off for having gone there. Maybe you didn't get the benefit you were hoping for. Maybe your condition hasn't been made better, but we at least don't want to be made worse from the experience, right? And so there's also a stronger, at least in terms of traditional Western ethics, a stronger obligation to do no harm than there is an obligation to be of benefit. So at the very least, whatever standards we come up with, we need to make sure that we're creating safer containers as much as possible. And even though there's going to be risk in psychedelic practice, no matter what we do, if you ask me, we're not going to be eliminating risk, but we can inform people of the risk and we can reduce the risk. And that may not mean that there's going to be harm. That I think we need to get out of the idea that harm is inherent in our practice. It can happen. So having that aspect of consent, being able to respect people's ability to make their own decisions. So even if they're taking on, like one question that can come up is around, some people don't want to tell people what's in the medicine. I'm personally of the position that I feel like people should consent to knowing what's in it. But I can understand also that there are some situations where they feel that part of the relationship involves a certain amount of trust. I think that can be a red flag to me, depending upon the environment. But there's an example, here are the possible risks you could encounter if you decide to consent if you don't know. So even if you were to make that extreme choice, you should still be able to know what the kind of risks and harms and benefits you should stand to gain. Or if you have any other medications you're taking, these sort of basic forms of consent in terms of disclosure. Other things that I could mention in terms of the ethics piece that Daniel was bringing up is A lot of people think consent is simply, do you agree? Do you consent? I laugh not to joke that you should at least be asking that, because there are instances of harm that have occurred where people have not consented. Or they consented to one medicine, but they didn't consent to this other medicine. And proper informed consent means that you have information, deliberation, and options, as well as understanding. So information, like let's say you're going in for a psilocybin service center in Oregon, you would have information about what is psilocybin, what are the possible risks, what are the possible benefits of it, what are information about what you're about to experience, or what are the likelihood. It doesn't have to be medicalized, but some sort of information that would be necessary for them to make an informed decision, as well as the options part. I think is often missed in this practice, because the people are not often given the alternatives to, like, for instance, not taking the medicine, or taking a different medicine or plant medicine, or different setting. And maybe they'd be better off if they're seeking spiritual connection. Maybe doing it in a medicalized setting wouldn't be appropriate for them. Or maybe if they have a history of substance dependency, maybe one medicine may be better for them than another. Or if they're on SSRIs, or right, and having that information about options other than taking the substance or taking alternatives, often we don't provide. In addition, the deliberation part is giving them space to consider what the information they've been given. Like if I were to ask you right now, are you willing to take a journey at this moment with this mystery X medicine that I'm going to give you, but it's going to transform your life and everything's going to be better after this? I'm going to give you 5 seconds to decide. I've reduced the deliberation window, which even if I gave you all the information and I gave you all the options, it affects your ability to give consent and proper informed consent because of that time pressure, which kind of gets to some of the other question that we have in here about time pressures. So understand that it compromises your capacity to give informed consent. And then the understanding piece, if I give you the information, but it's not in a language you understand, or maybe your education level, or the terms that they're using, or there's a whole bunch of different things that could be a barrier to understand, not just the time, but also other things that could be a result of privilege or culture or other things that could be barriers to understanding, that also can affect your ability. And this is all independent of questions about, do you have the capacity to even make this decision for yourself? Many people in this space who come for support are in extreme duress. They have clinical depression, CPTSD, are in an active dependency with a substance or other situations. And that alone should tell you that they are already in a diminished capacity for informed consent. It doesn't mean that they can't consent. It means that there needs to be more care and support for their informed consent than someone who is not in those extreme situations. Same thing with coercion. When we talk about time and money and pressure, that creates a coercive situation. Like, for instance, if you can think of parents whose kids are like got an emergency room and you have to make decisions, and that's a coercive situation that you would rather they have to make decisions when they're calm and it doesn't involve their kids. But that duress of extremeness creates coercive conditions for their decision making, even independent of, let's say, any PTSD, depression, or other things that could affect their capacity. All of those things affect informed consent. But I've been talking a lot, so I want to make sure we get back to more discussion. And I want to transition, if everyone feels okay with it, to the other thing that got a lot of votes, which is challenged around time pressure and money. And does time pressure and money actually work in opposition to ethical practice? And so you can already tell based on what I was just explaining that yes, my answer, at least personally, would be time pressure and money can work in opposition to ethical practice, because you can compromise. The time pressure alone would create potential for compromise of informed consent and people's ability to make their own decisions, which affects justice and equity, as well as doing no harm and making sure you're being of benefit. the money piece, maybe we should open up more. What are some thoughts you all have about time pressure and money? How do you find that shows up in your experience? Donna?
I know some people who have been through helping to set up field trip or helping to set up various ketamine clinics. And what they do is they start out with maybe giving people enough time to prepare and some contact with the therapist during a session. And they keep cutting off more and more time till they finally don't have prep time and they don't actually have a therapist in with them. And they actually don't do any integration and they just kind of go in and out. And they make money doing that rather than not making so much money. And it just, it goes from probably being okay ethically to really not being okay ethically.
Yeah. Agreed. Yeah, Daniel.
Yeah, I guess especially with the internet in the past 10, 15 years, how this tech startup mentality has infused in every industry, obviously in this one also. You can see it on the ketamine clinics and this growth hacking mentality about we have to grow and the numbers, and we start with exactly what was done was saying, like just cater service, and then that's what tech companies do. They start cutting costs and edges, and this is even beyond some medical work. Sometimes it can be energetic work. We can't have this. We got to be cautious about how this tech startup mentality is getting into this field, which is it's a healing field. And even we can do substances recreationally, but when you're talking about healing complex PTSD, anxiety, panic attacks, it is very detrimental for this field. And we're going to be seeing some costs around this on people's health.
Yeah, agreed. And I'd argue that we already are seeing the costs. Yeah. Nikita.
Yeah, I was primarily working for about a year in suicide prevention and on a project that was using ibogaine with special operations veterans, and it's really successful. But one thing that people would say is something really significant was they felt really seen and really heard in the process. And I worry that so much growth will just take that away, because as psychedelic providers, you can't possibly energetically be present for like an endless quantity of people. And so I think naturally you would energetically draw yourself back and not make yourself as present. But it's not scalable to practice that way. So a lot of me is maybe this shouldn't even be a business at all. I don't know. Yeah.
Yeah, thank you, Nikita. I really appreciate that. And honestly, some people do bring that up, that if you think about a lot of how a lot of different traditions have practiced, that it wasn't a capitalistic structure that was supporting spiritual ceremonial practice that was part of a culture and a community of healing and way of being in the world. Other thoughts? Well, we're getting to the last 4 minutes, and I know that this is a quick Q&A session, but I want to give everyone a chance to give a final reflection thought. Maybe we could come up with maybe one thing that you're taking away from this call. I'll stay on a little bit in case someone has another question. But what's one thing that if you were to create a standard, since we'll come back to that, what's one thing that you would make sure was included? If we were making the standards today, what's one thing? Just one.
I can go. So I think something like a fiduciary duty where you're always like you're solely acting in the best interest of the person you're with. And then, but at the same time, being detached from the outcome, so that you don't have a vested interest in any way, shape, or form. Yeah.
Okay, so fiduciary duty and detachment from outcome. Okay, who's next? What's your one thing? I'll say consent, because I already talked about that.
I would say peer mentorship.
Peer mentorship.
Something about deliberation.
Deliberation.
Nice.
I think the necessary decision to listen to what patients have to say, feedback.
Okay, listening to feedback and being open to feedback. It's implied, but I'm just going to put that in there. Ella or Daniel? Daniel.
I think with Donna, I agree with peer mentorship. That is a good one.
I'll extend that to be community, like having a supportive community. So not just having regular peer mentorship, but a community basis, also not just for yourself, but for the people you support, because often they're pursuing psychedelic therapies outside of a community of practice, especially in the West. Ella, any one thought?
Yeah, maybe I really appreciated what you were going through with those different ones. And yeah, I think deliberation and non-forcing, going at the pace of a client's most hesitant voice or whisper part in their system, not forcing the big experience on them.
Yeah, that's a really good one. I really like that. Yeah. Okay. We don't have answers to everything. We have usually more questions than answers at the end of these sort of things. But I hope that you found coming to this little Q&A session to be valuable. And in this sense, since we mentioned peer mentorship, this is a part of peer mentorship, and coming together and having these discussions, I feel, are really essential to ethical practice, to actually ask these questions and to have open, honest conversations and to feel safe and supported in having them are a real key element to creating more ethical practice. So the fact that you all showed up here and took this time, to me, tells me a lot about your commitment personally to ethical practice. And I really appreciate that you've done so. I'm going to be showing up at least to do like a Q&A this once a month through Nectara. So this will be ongoing offering. I am starting to offer a different training program that's also going to be available in the community. And that's going to start in January, but I'll probably find new ways to reinvent that. The other thing I was going to say as we close out here, because we're at the hour, is that I've been encouraging people making individual ethical practices and processes statement. So you yourself can make a statement on your website or on your intake where you state what your standards of practice are, if there are any codes of practice you follow, and it would create shares and transparently discloses any commitments you have for yourself, your community, your profession, what your scope of practice is, what it isn't, any spiritual, cultural, or ancestral lineages, your intersection, as well as provides a means for that feedback we talked about earlier. Give the phone number. If you have a peer mentorship group, or if you have a partner in accountability, or if you have someone in your scope of practice who does hold you accountable, disclose who that person is, or disclose who that community is. Disclose how often you go to show your work, basically, of that shadow work or whatever work of practice you do, and give people the means, even if it's just supportive feedback, even if you can't create the anonymous feedback yet, will go a long way to creating greater accountability and responsibility in this space. But thank you all so very much, and hope to see you again sometime.
Thank you, Sandra.
Much love.
Thank you so much.
Thank you
Thanks
so
a
much
lot.
for the space.
Thanks,
Thank you.
Sandra.
Appreciate it.
Bye.